Can you use histamine blockers like Claritin and Pepcid AC for PMDD? I'm Dr. Natalie Crawford. I'm a board certified OBGYN and REI, so I'm a fertility doctor. And every week on this channel, I help you learn about your body, your health, your hormones, and your fertility. And today I'm tackling PMDD. Before I dive in, I just want to say huge thanks for your support on this channel. I love all the questions you're asking. You are providing great ideas for content. And huge thanks and support for my new book, The Fertility Formula, which you can purchase anywhere. The Fertility Formula has been a bestseller. We've sold over 10,000 copies. People are loving it. And I love being able to provide you with this information. So a huge thanks. If you love the YouTube channel, please like, subscribe, leave a comment, or share it with a friend. So PMDD is Premenstrual Dysphoric Disorder, and it's similar but different than PMS, which many of us are familiar with. PMS is classically due to some of the higher symptoms of progesterone that happen in the luteal phase. Think breast tenderness, a little bit of increased appetite, bloating, and some slight changes of mood. But PMDD has much more severe mood changes, and this is usually due to a response to the dropping levels of estrogen and progesterone that happen in the second half of the luteal phase. The predominant factor in PMDD is mood changes, specifically anxiety, also getting severe depression. You can also have headache, brain fog, fatigue, and really feeling unwell. And PMDD is hugely disturbing for your life, and it's under talked about, and you're not often given enough resources if you do have PMDD. If we think about what's happening physiologically in the body, you have a follicle and you grow an egg in the first half of the cycle, and this makes estrogen. Remember, the first half of the cycle is estrogen dominant. So high estrogen, low progesterone. And then after ovulation, you're going to make both estrogen and progesterone from the corpus luteum, which is formed from the old follicle. And then in the second half of that luteal phase, as the corpus luteum starts to die because it can only live for 2 weeks, you're going to see a drop eventually in both estrogen and progesterone, but progesterone first. You then get a period, you get a new group of eggs outside the vault, and this process starts over. Well, PMDD is classically in that second part of the cycle once that corpus luteum is starting to die and progesterone levels are starting to drop. And we think it's due to the change of both estrogen and progesterone, but it's this drop, this going from a high to a low. It's not necessarily being high or being low that is problematic. It's going from this peak to going to this low. And where does histamine start to play a role in what is happening? Classically, we have treated PMDD, or you might have been told to take birth control pill because it stabilizes your hormones the entire cycle, or to take an antidepressant because it can stabilize your mood a small amount. And neither of those are wrong. But let's think about the root cause and what may be happening, because we think women with PMDD might have a sensitivity to histamine. Histamine is released from something called mast cells, which are a part of your immune system. And we know that estrogen in its high levels actually causes mast cells to release histamine. Well, not everybody has this, but if you have a sensitivity to histamine, you are going to notice some of the inflammatory changes that happen when histamine is released, which classically are a lot of these symptoms of PMDD. But you can also get rashes, itching, GI distress, you can get the bloating, the headaches, the depressed mood, the anxiety, all from a sensitivity to histamine. Well, what's important is estrogen stimulates the release of it, and progesterone kind of blocks this. So when you have both of them together, you tend to be pretty well. But in that back half of the luteal phase, so classically PMDD is the last 7 to 10 days of your cycle, progesterone drops first, and you are left in this less protected environment. And so you tend to have more histamine release because progesterone tends to block the release, estrogen stimulates it, and you're in an estrogen high to progesterone low environment. We also think that women who have worse PMDD also have a decreased activity of an enzyme called DAO. And DAO is in your gut and helps metabolize histamine. So think about the fact that if you make too much of it, that's a problem. But if you can't get rid of it fast enough, that's also a problem. So you're getting a double hit. Well, what we know is that these work on different histamine receptors. So any histamine 1 blocker called an H1 blocker, these are going to be your classic non-drowsy allergy meds. So Claritin or Allegra are great options here. This actually blocks H1 and can decrease the symptoms of any histamine response. And we classically think of some of the inflammation from seasonal allergies being that. But you may not know that Pepcid AC, this actually blocks histamine 2, your H2 blockers. And so this is classically taken for heartburn or GI symptoms where we know there's H2 blockers. If we take them both together, Now you are in a position where we are blocking all of these H2 receptors. And so even if you do have increased histamine, it's not able to bind to its receptor. And so if you are somebody who's sensitive to histamine, these medications are going to come in and can remarkably make you feel better. But are there risks, and when do you use them? One really cool fact about using histamine blockers to try to help your symptoms of PMDD is that you don't have to take it every day of the cycle. So, unlike birth control pills or even antidepressants that you might have to be on all the time, you can start these medications immediately upon feeling symptoms. So, option one is going to be when you start feeling symptoms of PMDD, you just start taking them, and typically you'll need them for about 10 days. Option two would be start them about 5 days after ovulation. So, if you track ovulation, let's say you're using a Apple Watch or a Oura Ring or Natural Cycles band, if you know when you ovulate, we know you're going to be good for about a week. So if you start these about 5 days after ovulation, then you are going to protect yourself from getting the low and having to treat it, which if you ask me, that's always my preference. The third option would be just start them immediately after ovulation. And if you have a longer window of PMDD symptoms, that's 10 days or more, then I would start them then. You should not need them for more than 2 weeks. That is the normal time of the luteal phase, meaning once your period has started, for most women, their symptoms get better. If that's not you, typically 3 days within your cycle, your symptoms get better. So we have the availability because these are over the counter medications with relatively few side effects and relatively inexpensive that you can take them just targeted when you have symptoms. So I like either just when you have the symptoms, take the medications. You will want to take them every day till your period starts. Or more empirically, if you're tracking your cycle, start them 5 days after ovulation. But if you want to start the day after ovulation, go for it. Another good thing is neither of these are going to interfere with the pregnancy. So if you are trying to get pregnant, I think it's important to know that these medications are not contraindicated, which is something we want to keep in mind if we are trying to conceive. The other thing to know about PMDD and thinking about it through this lens is that trying to reduce histamine can also be a helpful strategy. So, a couple important things here is one, let's avoid the really high histamine foods. And what are those? Those are going to be some of your aged cheeses, your fermented foods, and your red wine. So avoiding these, especially in the luteal phase or that late luteal phase, whenever you have symptoms, that's going to be an option for you to have less histamine in your body. Second is that DAO is an enzyme. And so one important vitamin that helps DAO activity is vitamin B6. And a lot of people are actually deficient in this. So you can get a multi-B vitamin over the counter and make sure that you're taking this every day or at least just in the luteal phase. And that can actually help support that DAO activity, which remember that breaks down histamine. And the last thing is that it's important to track your cycle. So if you've not ever learned to track your cycle, I do have videos on this. If you learn to track it and knowing when ovulation is, not just cycle day one, this can be a good way to target when your symptoms actually appear. And so you can take as less medication as possible. One of my favorites is basal body temperature because after you ovulate, your progesterone rises. You can pair any type of wearable with the Natural Cycles app, and this makes it really, really easy. Disclaimer, I am an advisor for them, but that's because I love the product. So hopefully you can try using Pepcid AC on Claritin or Allegra if you have PMDD, and then let me know if it helps you and ask any comments below. Thank you guys so much for listening. Don't forget to check out more videos, the As a Woman podcast. Find me on Instagram at Natalie Crawford MD, and check out the Fertility Formula. Thanks, friends.